So when a patient comes in for a breast augmentation, we address multiple areas and we want the most informed patient across the board. So the first question many patients ask is, well, where does the implant go? And there's two basic places. It's under the muscle or on top of the muscle. If it's on top of the muscle, you have to have enough kind of tissue to camouflage the implant. So for the vast majority of patients, the implant goes under the muscle. Because the muscle camouflages the implant, it decreases the risk of rippling and implant show, and also it's the safest in that sense that it decreases the risk of capsular contracture, which is kind of scar tissue that can form after after breast augmentation in a very small percentage of patients. Um, so for those reasons, we put it under the muscle for the vast majority. The second question patients ask is, well, what incision do you use? Do you use around the areola or in the crease? And it depends on how large the areola is. If it's large enough for us to be able to put it through that incision. But for the vast majority of patients, it's actually through the breast crease, because number one, it's not directly in the line of sight of the breast, so when it heals, it's very hard to see. So from that sense, it's a more camouflaged incision. Also, because you're going through the crease and not around the nipple, there's a decreased chance of capsular contracture. The nipple is considered the kind of quote unquote the dirtiest part of the breast. And so there's a higher risk of bacterial contamination by putting it through the areola. And the things that can cause capsular contracture are bacteria and blood. So when we do a breast augmentation, we do everything we can to minimize the chance of any kind of bacteria. The nipples are covered. We use a Keller funnel so the implant doesn't come in contact with the skin. Everything is super prepped. Change gloves prior to handling of the implant. So for those reasons, it's the safest to kind of go through the crease. The third question many patients ask is, well, silicone or saline? And each has its pros and cons. Saline, if it ruptures, it just leaks water. However, there's a higher chance of rippling with the saline implant, and it can loosen the tissue over time, causing a water hammer effect. Silicone implants, the newest generation, are super safe. They feel the most natural. You can cut them in half, and they basically don't move. And there's actually a third option, which is called the ideal implant. It's a double baffle saline implant, which is kind of a halfway point between the silicone and saline implants. It feels more like a silicone implant, but it is a saline implant, so if it ruptures, it just leaks water. And then the other question that comes up is, well, how do you figure out what size implant to put in me? Well, that's basically patient preference. We want to put in the size that makes the patient happy. So that's why we have special sizers here in the office that fit under the bra. They don't look like a breast implant. They're actually shaped like what it would look like after the implant goes in, so it gives you the best idea of what the implant's going to look like. We use 3D imaging as well. We take photographs in the office, and then we use a computer program that basically approximate what you're going to look like after a certain implant. And it can put you in clothing, it can put you in a bikini, to give you that idea of what's it going to look like after we're all done. And then we figure out, we do measurements in the office to figure out what the best implant profile is for that patient. The implant, you want to fit right on that chest wall, and you want it to look the most natural. There's moderate profile, which is kind of the widest implant, and it's going to give you a more natural look. And then high profile, if you want a larger volume, you can't go all the way out to the back of the chest. You're going to have to narrow the profile and to get that same volume in. So it's a narrow profile implant. It's going to give you a little bit more projection. But basically, the implant profile is tailor-made for the patient.